Hi, good evening. My name is Dr. Sonal Kumar Jha. I am a general laparoscopic surgeon. I work with Crest Hospital, Vasundhara, Ghaziabad as a consultant. Today we are going to talk about Sitz Bath. Sitz Bath is like we advise our patient to take a tub, a big plastic tub. It should be filled with lukewarm water. I particularly suggest not to put any kind of betadine in it. Plain lukewarm water, and the patient has to sit it in the tub and strain, like the straining while they strain for passing stool. So they have to strain and at least to sit in the tub for 10 minutes. It should not be too warm so that they should burn their skin out. It should be lukewarm, tolerable to the skin, and it should be done at least 3 times a day. Like I explained it, the patient should sit in the tub properly in the kneel down position, and they have to strain it in the tub. It should be filled, the anal orifice should touch the water. It should not that it is only touching the skin. The buttocks of the skin of the buttock should not only touch, the anal orifice should touch the water, and then you have to strain it inside for at least 10 minutes. Locally, it heals the inflammation. The idea of Sitz Bath is to subside the inflammation both in fissure and hemorrhoids. So up to a certain extent, it reduces the pain to a lot extent in cases of patient having fissure in ano. Sitz Bath is indicated in all anal fissure patients, pre-surgery and post-surgery, and even in hemorrhoids patients, pre-surgery and post-surgery. Sitz Bath is normal lukewarm water without any mixing of anything. Normal lukewarm water, what you do on a gas stove or a geyser water in the washroom. You can just pour it into the tub, tolerable to your body temperature, and you can just soak your buttocks in it and take a Sitz Bath inside. Like I said you earlier, at least 3 times a day, and try and sit in the tub for at least 8 to 10 minutes. Like I said earlier, 3 times a day, and after you pass your stool, you clean off, and then you can have a Sitz Bath. Depending upon the condition of the patient. Nothing. You have to just use a temperature what is tolerable to your skin. That's it. Reduces the inflammation, like I said earlier. It reduces the inflammation and gives comfort to the patient. It eases it down. See, any surgery being done causes a local inflammation. And rectum per se is the area, the anal orifice, all the toxic materials comes out. So there is high chances of getting infection locally, and which can lead to proceed to inflammation of the local wound. So that's why we advise patient for at least a week or couple to do Sitz Bath at least thrice time a day. Yes, if you sit in too hot water, you may burn yourself. So we advise a lukewarm water tub. It doesn't, it just helps to improvise the symptom. It doesn't treat the condition. If you liked my video and if it was informative to you, please like the video and give your valuable comments. And to all my seniors who are seeing this video, I would like a valuable add-on which can help both me as a clinician and to my patients worldwide. Thank you so much.